Hey there, welcome back to today's episode. I'm Chong here, your certified fertility dietitian and founder of Pristine Fertility. Now, if you're just starting out IVF or maybe you're considering one, or you could be someone who have tried IVF but unfortunately it didn't work for the first round and you are now asking what can I do right now to boost my chances? And in this episode, I'm going to walk you through what to test for, eat and avoid before your IVF based on the science and what works for my one-on-one clients inside my Mastering a Health program. Let's get started. Now, before you jump into supplements or meal plan, first thing first you need to know is your nutrition status, right? Otherwise, you are just guessing. And if you know me long enough, I do not like guessing. I do not like to give my client generic plan. I really giving my advice based on your lab tests and guided by data and science. So here are some of the key blood tests I recommend if you are someone thinking about starting IVF, or even if you are someone who tried to maximizing everything you can for your next round IVF. Make sure that you want to get all these tests done before your next cycle, right? So number one, vitamin D. Why is it essential? So vitamin D is not just for bone health. There's one study suggests that women with higher vitamin D level had a better IVF success rate as well as outcome. In terms of number, we're looking at 74% higher odds of giving birth compared to those with a lower level. So absolutely, the first test that I want you to get checked is vitamin D. And if you're vitamin D deficient, make sure you discuss with your dietitians or even your doctors to make sure that you properly treated them. Now, secondly, ferritin. Ferritin is the marker we use to assess stored iron, and it plays such a crucial role in supporting ovulation, egg health, and a healthy uterine lining. And in one study with women, over 300 study group with infertility and lower ferritin level, it was found that after receiving iron treatment by just raising the ferritin level back to the normal range, it helps to double the live birth rate as well as cut the miscarriage risk into half. That's a significant impact if you ask me, right? So once again, if you are someone who known to have iron deficiency, you want to make sure that this level is properly treated and normalized before your IVF cycle. Of course, we also want to check for your thyroid panel, in particularly if you have a suboptimal thyroid function, that also linked to reduce your IVF cycle as well as reducing the chances of success and heighten the risk of miscarriage. And last two very important tests that I don't think that these often get checked enough is homocysteine level. So homocysteine level as a dietitian, it's helpful to help us to decide on whether or not your body are effectively absorb different type of folate supplement, right? It also gives us an indication that if your level is higher, it might be not just because of folate, it might be because of you're not getting enough of vitamin B12 or vitamin B6 or even choline, right? So just to name a few of different nutrient that we potentially want to consider. So homocysteine level is something that we want to check more routinely, more actively. And study also shows that women with unexplained infertility or even recurrent miscarriage often also have a much higher significant homocysteine level. And lastly, zinc. So zinc is a powerful antioxidant. So if you are tested low in zinc, and in this case, we might also consider not just maximize food through diet, we might be also considering trying much or higher dose of zinc supplementation for cellular protection as well as to support hormonal balance to increase the chances of generating a much more healthy egg and better quality egg for you. Now, what I share are just some example of the lab tests that I recommend for my clients inside our Mastering a Health program in order to personalize the supplements plan for my client. Now, to make this easier for you, I have created a free IVF lab test checklist. So if you're interested, make sure you download it now in the description box below so you are clear what to test, what to ask from your doctors, and you feel more confident that everything is within the normal range before you start your IVF cycle. Now that we have covered what to test, let's talk about what to eat. So one of the best based study, research diet type. It's known as Mediterranean diet. And this is what exactly our core foundation of our teaching inside our Mastering A Health program is to teach you how to get started with adopting Mediterranean style of eating pattern. And there's a reason why, although there are many research different style of eating diet, right? I would say that Mediterranean style eating approach is still currently known as the best non-type diet to support your fertility, and that include to help IVF success as well. So one study, a meta-analysis, which is quite a highest ranking study, shows that women who follow a Mediterranean style diet had a higher clinical pregnancy rates as well as better embryo quality. And it also helps to improve live birth rates as well after the IVF treatments. So here are some tips for you if you're wondering how to get started with Mediterranean style of eating plan. Number one is to have less red meat, but think about how can you include more fish or seafood, lean meat products such as poultry, like chicken, legume, eggs, or even tofu, and how you can incorporate more with your cooking extra virgin olive oil, or maybe it's avocado with your breakfast or snack, maybe some nuts and seeds. And you want to make sure that your meals are packed with colorful vegetable and based on healthy whole grain products like quinoa or maybe brown rice, right? This will help to balance your blood sugar level, reduce inflammation, as well as supporting a much more optimal hormonal production. And most importantly is we want to support your egg health and optimize everything we can for a better chances of generating that one good egg, right? Trying to get pregnant and want to nourish your body the right way? Our free 7-day fertility meal plan is designed to support egg health, balance hormones, and reduce inflammations using real food you will actually enjoy. Now, inside the meal plan, you will get 7 days of dietitian-approved meals, easy and delicious recipe, and done for you grocery list. It's completely free and it's a perfect first step if you are ready to take charge of your fertility journey. So grab your copy now and tap the link in the description box. Now, moving on next, let's cover things that you do not want to do during your IVF prep. So first thing first, of course, it would be best to avoid all this ultra-processed food or even fast food. They're very high in saturated fats, as it's known to increase your oxidative stress, which can harm the egg health and quality, as well as refined sugar. So when we talk about refined sugar, not just from the unhealthy snack food or dessert, but we also got to focus on things that you consume, your drink as well, right? Whether you are having any sugary drink or sugar-sweetened beverages like soft drink, all of these can spike your insulin, your blood sugar level, and hence disrupt the hormonal signal, right? And if you're someone who are still consuming alcohol, you may want to also take the opportunity to start reducing your alcohol consumptions, or even thinking about quitting your alcohol drinking patterns, as alcohol, even small amount, also known to negatively affect your cycle, your follicular development. And lastly, don't forget all this environmental exposure, the hormone disrupting chemicals like the BPA from the plastic exposure, paraben or phthalates in your skincare, all can also influence your body hormone level as well. So you want to be more diligent in terms of checking the products that you use and define a way how you can minimize the BPA as well. And lastly, like I say, it's not just about what you eat, also about how you live as well. Now, sleep is incredibly important. If you have a poor quality of sleep, it also affects your body hormones. So you want to also implement some strategies how you can aim for more consistent, better quality of sleep to help you to restore your body hormone, better manage your stress level and support your hormone level, and focus on maybe some light exercise and movement like walking, yoga, or stretching. They are all good for blood circulations, for stress relief. But you also want to make sure you don't go too much of exercise or engage in any intense workouts, especially when you are in the stimulation cycle, right? And lastly, thinking about how you can best manage your stress, right? Because starting IVF or during your IVF prep, it can really be emotional and quite intense. So you want to also think about who will be your support buddy, whether that could be, your partner, or maybe it's to seek out some professional help. It could be like myself, fertility dietitians, or maybe a coach. Or you could also think about like a yoga or meditation support as well to help you to manage your stress, right? And all of these can help you to get a better cortisol hormone regulations, as high cortisol or even cortisol imbalances can interfere the IVF and the hormone level as well. So these are just some of the core strategies that I teach with my one-on-one client inside our Mastering a Health program. But I really want you to know as well. So you are watching this episode and feel like, oh my gosh, I got to try this right now, right? So to wrap up today's episode, number one, start with the right lab test, so you can personalize your plan and think about how you can work with a specialized fertility dietitian. And secondly, get started to eat much more healthy, specifically Mediterranean inspired, fertility meals. Avoid those sneaky hormone disruptor, as well as thinking about how you can support your body with a more consistent daily healthy lifestyle habits. Now, if you're interested, make sure you go and download our 7 days free meal plan right now. And don't forget to also grab your free IVF lab test checklist or in our description box below. And as usual, if you like today's episode, don't forget to subscribe, and even better is to share this episode. And thank you so much for watching, and I'll see you in our next episode. Bye for now.